Dear colleagues, the topic of this presentation is the use of entrustable professional activities in a dental curriculum and will explain the background and our context of the use of EPAs and give the results of the students' view of this. My name is Fokkinga and I'm a dentist, researcher and teacher. Unfortunately, I'm not in Kuala Lumpur at this time. In our country, the Netherlands, which is situated in Europe, we have 3 dental schools. Our school is located in Nijmegen and is part of the Radboud University Nijmegen Medical Center. The Dutch undergrad dental program consists of a 3-year bachelor program and a 3-year master program. After this 6-year program, the starting professional proceeds to independent practice immediately upon graduation. Therefore, from the day of their graduation, all dentists should be trustable to perform the clinical work relevant to their profession. To prepare the students for this, we developed an interprofessional dental clinical workplace in which they treat patients with all kinds of problems. This clinical workplace was started in 2017 and was called the Student-Run Dental Clinic. This Student-Run Dental Clinic is an innovative interprofessional clinical workplace where 4th, 5th and 6th year undergrad dental students work together with 3rd and 4th years of oral hygiene students. During a continuous 3-year program, teams of 16 students work in 18 clinics and take care of about 600 patients per clinic. Supervisors of both professions, dentists and oral hygienists, are involved. The program consists of clinical sessions, patient treatment, and as well as theoretical sessions, clinical reasoning. Entrustable professional activities, EPAs, were introduced at the start of our student-run dental clinic in 2017. Entrustable professional activities are described as units of professional practice that can be trusted to the trainee. EPAs offer the advantage of being directly observable and measurable, integrating knowledge, skills and attitudes into authentic professional tasks. Working with EPAs guide both the supervisor and the learner to prepare for independent practice by trust and entrustment decisions. EPAs helps the student to develop this trust and allows teachers to trust the students to do their work. 14 EPAs were developed for the student-run dental clinic, which represent all professional activities a dentist should be able to perform independently. I will shortly explain these EPAs. The first one is diagnostic, diagnosis and evaluation, like doing a checkup or intake of a new patient. The second one is making a treatment plan for a patient. Then we have acute patient care, for example, trauma or pain. The fourth one is information, prevention and non-operative treatment, for example giving an oral hygiene instruction to a patient. Then we have periodontal treatment, like measuring pockets and cleaning the roots of a tooth. The sixth one is endodontic treatment, doing a root canal treatment. The seventh one is direct restorative treatments, which is making fillings, for example. The eighth one is the indirect restorative treatment, like making a crown. Prosthetic treatment fixed means, for example, making a bridge if a tooth is absent. Prosthetic treatment, which is removable, includes partial or full dentures. Then we have care for specific groups like children or frail elderly. The 12th one is oral function and dysfunction, which can be related to temporomandibular complaints. Interceptive orthodontic treatment is, for example, making a retention bar to remain the teeth in position after orthodontic treatment. The last one is surgical interventions, which can be, for example, extraction of a tooth. In this slide, you can see an example of a schematic EPA form. For all 14 EPAs, an EPA form was constructed in a digital portfolio system. 5 of these EPAs are used as well in the oral hygiene program. Each form includes a maximum of 4 criteria supported with rubrics and explanation, on which the student first assess themselves. Also a narrative reflection filled in by the student, a narrative feedback filled in by the supervisor on the dental aspects, and the student's professional behavior is included in the EPA forms. Students use EPAs to assess themselves and their clinical work. Supervisors discuss these EPAs and assess students twice a year using the CanMats rules. The student-run dental clinic and the use of entrustable professional activities are evaluated twice a year, using a digital questionnaire for all students. The questionnaire consists of 31 questions, using a 5-point Likert scale. Additionally, students were asked to give narrative feedback. During the evaluation in June 2019, 64 students of dentistry and 31 oral hygiene students responded. Results show that students are very satisfied with the learning opportunities of the student-run dental clinic. Students feel that working with EPAs enhances both their technical, dental skills and their professional development. Students in their first year in the student-run dental clinic appreciate working and learning with entrustable professional activities more than older students. Disadvantage of the use of EPA forms mentioned by students is the administrative burden. In conclusion, working with EPAs gives the student the opportunity to reflect, self-assess and self-direct learning. Work has to be done on the improvement of the use of adjustable professional activities in the total assessment in the student-run dental clinic, since this is new to the dental field. More research is going to be done at our school concerning the use of adjustable professional activities. Working with entrustable professional activities in a dental undergraduate program seems to stimulate learning and facilitates assessment and entrustment. Continuously evaluation and research can improve the use of and understanding of working with entrustable professional activities. Thank you for your attention. If you have any questions, I'm happy to answer them through email. Finally, I hope you have a good conference and I wish you a safe and healthy trip home.